Congressman Harley Rouda here, and I'd like to start off and thank our panelists for taking time out of their busy schedules to participate in this discussion. I've been holding a number of these telediscussions to increase awareness and facilitate discussions around important, long-standing issues to our community. And that's obviously been magnified as a result of the COVID-19 pandemic. Earlier this week, we had the opportunity to have a discussion on food insecurity in our community. Today, however, we're discussing how to combat domestic violence and child abuse. And next week, I'm planning on hosting a discussion on the increased need for mental health services. I'm hoping that these discussions, we can increase our awareness of the different challenges Orange County faces, both pre-pandemic world and in the context of our current COVID-19 reality, and further engage stakeholders and community members so that we can respond appropriately and quickly. Today, we're here to discuss the rising number of domestic violence and child abuse cases since COVID-19 impacted our communities. Studies show that on average, nearly 20 people per minute are physically abused by an intimate partner in the United States. Intimate partner violence accounts for 15% of all violent crime. Let me say that again. Intimate partner violence accounts for 15% of all violent crime. And only 34% of people who are injured by intimate partners receive medical care for their injuries. Data also shows that victims of intimate partner violence lose a total of 8 million days of paid work each year, the equivalent of 32,000 full-time jobs. Over 600,000 children were reported to be maltreated in 2019. All those statistics were before COVID-19. Unfortunately, times of public crisis tend to significantly increase violence within households. And I'm hoping today's discussion will give us a better understanding of the impacts of COVID-19 and how to address domestic violence and child abuse. Reporting is already showing that the number of calls to domestic violence prevention hotlines has been increasing since the COVID-19 pandemic began. In fact, according to the Orange County Sheriff's Office, calls involving family disputes have already gone up about 24%. And as you might suspect, as a result of school closures and stay-home orders, many victims of domestic and sexual violence are isolated with their abusers. And as a result, they find it even more difficult to seek help and support. And children are also much more exposed to their abusers as they are no longer able to seek refuge at school. So organizations like these we have on our panel here today are adapting and having to find new ways to provide victim services while already being stretched in terms of funding and resources. I sponsored legislation including the Bipartisan Domestic Violence Public Health Emergency Guidance Act to encourage federal engagement with domestic violence stakeholders, as well as relevant law enforcement, to issue guidance and outline best practices and resources for state and local enforcement agencies with a unique focus on addressing domestic violence effectively while limiting potential exposure during COVID-19. In the CARES Act, Congress allocated $45 million for the Family Violence Prevention Services Act and another $2 million for the National Domestic Violence Hotline. But it's clear these funds are not enough. While domestic violence and child abuse programs have been historically underfunded, I'm deeply concerned how insufficient these funds are to meet the challenges that are currently cropping up and becoming more and more relevant in these coming months. So with that, let me introduce our panelists. We do have a robust panel here today, so I'll give a quick introductions and then we can go straight into the question and answer session. Sheila Boxley is the president and CEO of the Child Abuse Prevention Center. Sheila served over 2 decades as president and CEO of the Child Abuse Prevention Center. That center has grown from one local agency with 3 employees in 1997 to now a statewide agency. Krista Niemczyk, and I hope I pronounced that right, is the public policy manager at the California Partnership to End Domestic Violence, where she represents domestic violence programs throughout California at various government agencies. Her organization is California's recognized domestic violence coalition, representing over 1,000 advocates, organizations, and allied groups. Maricela Rios Faust, and again, I hope I got that right, is the CEO of Human Options. She's got 12 years of experience with high-risk populations, and my wife and I have had the privilege of visiting their operations. I am always so incredibly impressed with the job they do in serving 38,000 individual affected victims on an annual basis. Kristen Douglas is the Director of Government Affairs at Child Help. Child Help provides programs such as advocacy centers for those children already affected by child abuse and prevention programs designed to educate children and aid in prevention. Mark Lee is the CEO of the Women's Transitional Living Center, WTLC. WTLC was created as the result of a needs assessment study of battered women in Orange County conducted by the National Organization for Women's Task Force on Family Violence. It provides residential program, a children's program, a crisis hotline, and a community services program for victims of violence. Last, Greg Young is the program director at Laura's House, where he oversees the clinical operations within all of Laura House's locations. Laura's House provides shelter and supportive services to more than 5,000 abused women, men, and children, and counseling, life skills, education, and legal advocacy to over 55,000 individuals. Additionally, I'd like to recognize some folks who are not part of the panel today, but great partners to all of us. We continue to look at ways to serve our community, so we want to thank Chris and Jamie from Head Start California, Colleen from Head Start Orange County, and to everyone at the Orange County Women's Project. All right, so let's move to the questions. In mid-March, our way of life here in Orange County and across our great country changed as we started experiencing the rapid spread of COVID-19 and its impacts. The pandemic has created a variety of additional public health emergencies. We have faced a lack of tests, a lack of personal protection equipment, PPE, hospital beds, essential food services for our most vulnerable populations. But every one of you, your organizations, you had to adapt to this changing environment. And so with that, if all of you could just take a moment and we'll start with you, Sheila. Just give us a sense of the number of calls to your hotlines, changes in requests for shelter and housing, changes in how you handle your health services, legal services, really how you've had to change your mission, the application of your mission to meet your vulnerable communities that you're serving. So Sheila, why don't you go ahead and take the first shot at that?
Sure. I think like almost every community-based organization, we've had to be creative and inventive in order to continue to do the services. We represent 500 family resource centers around the state, and about a third of those have continued to be open with appointment times. Others are services virtually. And so what that means is instead of doing an in-home visit, it's being done virtually, sometimes FaceTime, however it might work and what the families have available to them. We've also gotten calls and lots of distress from people saying, I have court-ordered trainings that I have to do in order to reunite with my children, and now I can't go into a training. So we're doing one-on-one trainings for those individuals to help those families be intact. I can tell you that the demand is huge. In one fairly small Northern California community, there were over 700 people who showed up the first day just needing food. The basic essential needs that families have, we are delivering. We're taking them to the door. We're providing cribs. We're providing food. We're providing cleaning supplies, diapers, things that people need. But very importantly, trying to stay in virtual context so that we have eyes on the children and we can detect the mood and the abilities of the families and the parents. And so it's taking a lot of time and a lot of energy, but a lot of dedicated people around the state are committed to doing this.
Thanks, Sheila. Mark, do you want to go next?
Sure, yes. We've also experienced a huge increase of callers to our hotline number. In March 2020, we've had 132 calls to our hotline, which is a staggering 135% increase from the same month last year. And most of these calls were COVID-19 related calls, and they are still needing shelter services, counseling, and legal support, even during this pandemic time. I believe that because of the COVID-19 situation, that their level of anxiety and fear is even more heightened now, which might represent the increase of calls that we've experienced. Like everyone else, we did have to adapt and provide virtual programming. But because many of us here are essential businesses and organizations, that we still have to be in operations. We still have to provide in-person services. So we're doing double the work with the higher demand of services, and trying to be accessible to anybody in any situation, whether that's in person or online.
Krista, do you want to go next?
Sure. Well, Congressman, I first want to thank you for even having this really important conversation at a really critical juncture for a lot of children and families. So thank you for taking the time to do this. Child Help, we do soups to nuts across the country when it comes to child welfare. So I could talk all evening about our programs, but the one tonight that I think is the most important is our national hotline. So Child Help does the National Child Abuse and Neglect Hotline across the country. I'm happy to say that California, in a good sense, is our #1 state that calls in, which means Californians are identifying abuse and doing something about it. So that's something to be very proud of. But so Child Help, we're one of the 6 national hotlines of reference for the federal government. We work with every jurisdiction across the country. We are the only hotline that has text and chat right now, which is really exciting because we're able to meet kids where they're at. And we're finding that the majority of kids coming are 13 to 16 years old. But we've had an increase of 428%. 428% since COVID started. And a lot of new cases that you wouldn't think about, college kids coming home who thought they were getting away from their abuser, but now are stuck back in the situation. Young kids who are now taking care of their baby brothers and sisters, calling in for advice as to how to make a bottle. Anything across the board that you can imagine. We were successful in getting our 24-hour-a-day, 7-day-a-week master level counselors set up in their homes so that they're able to do this without skipping a call or a beat. But the challenges that we're having is we're self-funded. We do a lot of this funding through events, which all were canceled. And now we're having an increased demand. Even our phone calls are up by 32%, which is pretty extreme for us. So we're self-funded as we're working right now with the federal government to get a line item. But then the COVID came in, slowed down that process, and we're trying to move forward. So I can talk all day about it, but there is extreme stress out there. Children are hurting, and we really appreciate members like you stepping up and having this conversation.
Thank you. And again, I apologize if I mispronounce this, but Maricela, am I pronouncing that correctly?
Yeah, yes, you are, Congressman. Thank you so much. Thank you also for having us and for having this important discussion. Similar to what's been said, we also saw a spike in the number of requests for service. What I wanted to kind of add a little bit of context to is that we were actually seeing increases to our hotline as well as to our walk-in centers. And for Human Options, we actually are the lead agency in 2 family resource centers here in Orange County, one of which was located on a school campus. And so within a matter of 3 hours, we had to pack up our family resource center and redeploy our staff as the schools were shutting down, all while still making sure that families and communities in need that were already accessing services that are domestic violence and intimate partner violence related, we had to get communication out to them that we were still available for services, that they were still help available. And so at the same time that we were doing that outreach, really we're finding ways that and recognizing that as people are sheltering in place, there's fewer opportunities to make safe calls for service. And so what we did is actually begin to change the conversation as we did outreach to the clients that were coming into the walk-in centers and really talk more about what are the needs that you're having right now. We want to let you know that we're available for anything, so that they had some kind of a lifeline and didn't feel like, well, when is it safe to call when everybody's home? Because what we have typically found is that when abuse is occurring, they are finding for the opportunity for their abuser to not be there. And so despite that, for us to, even as these orders were coming through and as people were having more limited windows of opportunity to call and reach out, we were still seeing about a 50% jump. Many of the calls that we got within the first 2 weeks were requests for legal advocacy and how to handle visitation with their abuser, how to handle court proceedings, court restraining orders and things like that. And so we were really doing a lot more education. What we are finding now, which is pretty common, a common pattern that we've seen at Human Options over the years, is that during times of economic uncertainty, and so the longer this goes on, there is increased economic uncertainty for survivors, is that we find people reach out more to our walk-in centers because they are afraid to leave out of fear that they become homeless. And so what we find is they're giving more outreach in terms of our personal empowerment program, which we have, as well as Laura's House and WTLC, and parenting. And that's just a way of getting connected. And what we're finding is reinventing that in a virtual world, and maintaining confidentiality creates some really interesting challenges for us.
Thank you. And one of the best things in my job is when we get to go to the Library of Congress and pick out excess books from the Library of Congress and bring them back to our district. And my wife and I were able to do that, pick out a bunch of children's books and personally deliver them to Human Options. And that's one of the more rewarding experiences we get to do. Let's turn to Kristen next. Kristen, if you could take a couple minutes and kind of give us your thoughts on that question.
Yeah, so I have the privilege of working with groups like those that are on the call all across the state. And we've been hearing the same struggles and challenges, unfortunately, of programs overnight having to rethink how they provide services. And so for us at the state level, a couple of things that have been really essential is, first and foremost, continuing to get the word out to the general public that help is still available, that the 24-hour hotlines are continuing to operate. Congressman, you referenced the National Domestic Violence Hotline and the increased funding to support them in this moment. They operate not only a phone hotline, but an online chat and a text service. I know Greg from Laura's House can talk about their text service as well, but programs are still available. So anyone experiencing violence should know that they can still reach out for help. I think it's also been incredibly important for us to recognize that this was a crisis before COVID happened. Home was not a safe place for far too many Californians before the shelter-in-place orders came down. And while this pandemic is highlighting that need is not new. And so as we talk to legislators at the federal and state level about what's needed, it's been really important for us to continue to build that through line of this was essential to invest in before. It's still essential as we talk about COVID-19. And honestly, as we think long-term, I know we're all looking forward to a time when the shelter-in-place orders are lifted, but what I know from talking to folks like Mark and Maricela and Greg is that we're anticipating a spike in calls. All those survivors who aren't able to reach out now, or who are staying where they're sheltered in place, even though it's not safe, but because that's a roof over their head, are going to need longer term housing supports. They're going to need counseling services. And so it's important for us that we continue to show up and provide the support to these programs and doing that hard work, and that all of us are there for that long term. We know that unfortunately, these are not challenges that are going to subside when the immediate focus of crisis ends.
Thank you. And Greg, you are up next.
Okay, well, again, thank you for holding this this event and bringing the awareness out to into the community. Like everyone else, Laura's House, we had to shift quickly and shift the way we hold services quickly. All of our therapeutic, case management, legal services have been converted to do through teletherapy. We did see a large increase in our hotline calls, and as Krista mentioned, we also started up our chat and text line for those who aren't able to call. They can, if they can have access to a phone, to at least text, we can help them as well. And Krista, thank you for bringing up. I was going to bring up the point where as much as we've seen the jump or the increase in calls since the middle of March, I think the shock wave of this, the ripple effect, is going to be exponential compared to what we've already seen. It's going to be greater than the event itself, and it's going to carry on for some time because like Krista said, there are many out there who are just trying to keep it together, who are hunkered down in their premises, who don't have a way to either reach out or connect. I mean, a lot of the hotline calls that we get are actually getting calls from family members and from neighbors of people who need help that can't get that help. So we're, moving and adjusting, some of the changes we've had to make. We've had to, we have a couple of resale stores. We had to close those, of course, not essential. That was a big part of our fundraising. I'm happy to be a part of the other agencies, and we work closely together, and we're all, working as a team to try to combat this pervasive illness out there.
Thanks, Greg. Next question, Kristen, Mark, let me direct this to the two of you. And we've kind of talked about this a little bit so far, that one of the biggest challenges always with victims that have been abused, whether it's the kids or domestic violence with a partner, is getting them to come forward, getting them to communicate and seek help. And certainly with the coronavirus, COVID-19, it's even worse. And you guys have talked a little bit about trying to reach out to those vulnerable populations. What else can we do? And when I say what else can we do, not just what you can do, what can we do as citizens in our communities to help you do your job better and help protect these individuals? Who wants to go first?
That's a great question. I think it was mentioned earlier that the increase, like educating our neighbors and friends and family members that help is out there, and letting them know that not only can the victims or the survivors can reach out to them, but there are national hotlines and local domestic violence hotlines that they could always reach out to 24/7. We've experienced a lot of callers to our hotline that say, I need shelter and I want to go to shelter, but this fear of contracting the virus, and there's been a lot of talk on the news about how dangerous, and it is, the COVID-19 is lethal and dangerous, but this extra fear put on place that they're afraid to take that step and come into shelter because they are imagining that they are going to be with other people that might have the virus. So they are actually holding back. So we try our best to reassure them and educate them that we do our part to place safety measures to ensure everyone who's in our housing program, both residents and staff, are following right protocols so that any risk of contracting the virus or spreading the virus is limited and restricted. So we want them not to use the COVID-19 as an excuse not to seek support and not to seek shelter.
Thanks, Krista.
So I would add all of that to be sure that everyone reach out. And, again, even if you aren't the one experiencing violence, but are worried about a friend or a loved one, reach out to hotlines. They can help. The trained advocates that are answering those calls can help you think about how to provide that support. The term that is so often used around COVID is social distancing. And I think internally, we keep reframing to what we need is physical distancing, but we need social connection more than ever, right? Survivors who may have already been feeling isolated and have had those friendships and family connections broken by the abuse are feeling even more isolated now and need people to reach out and check in. And reach out and check in on your friends, even if you're not worried about the health and well-being of their relationship, right? These are moments of stress for the best of relationships and the best of family situations. And I also will just put in a shameless plug here for all of these programs. We've heard them all talk about the decline in fundraising, major fundraisers being canceled, thrift stores that provide revenue being canceled. We know that this is taking a devastating toll on the economy and on everyone's individual finances, but for those that do have the ability, even through this challenging time, to donate to programs, programs like those on the panel right now need your support more than ever. I'm sure you can find them. I will say on the partnerships website, we have an online searchable map of all the domestic violence programs and links to their websites where you can donate. But I know they need the community's support today, tomorrow, and months from now as well.
Well, Chris, that was great advice to reach out to friends and loved ones, even if you're not concerned about the relationships they might be in, because that's what everybody needs right now. And you're pointing out the challenge of funding really leads me into my next question. With the unemployment numbers going up and financial stress increasing, people being safer at home and spending perhaps more time than they want to at times with each other, we're seeing obviously an growth in domestic violence and an even greater demand for your services. And we talked about how challenging that is, especially in this environment. And we're also seeing donations go down. So, let me start again, Krista and Sheila and Marcella, if you guys want to jump in on this, but I want to understand from your standpoint, is the state and county ready to continue to be able to provide these services both now and in the long term as you see your finances being challenged by the current situation?
Well, I can start and then would love for others to speak about the county and local level. And Congressman, really want to thank you and your colleagues for including an increase to the Family Violence Prevention and Services Act. The reality is of government money to support these programs, the majority comes from the federal level. So the Family Violence Prevention and Services Act is one key area, and the other two are the Violence Against Women Act and the Victims of Crime Act. So we continue to advocate and work with our national partners to ensure that, some funding increases there are included in the CARES Act. We are working closely on making sure that Governor Newsom and the California State Legislature are well aware of these needs as they think about emergency COVID response and as they work to craft a state budget for the next fiscal year by the June 15th deadline. It's no secret that the state budget is looking a lot harder and grimmer as this takes its toll. But we've been doing a lot to try to make sure that folks understand how essential these programs are to the safety net. The state provides $20.6 million to support about 102 domestic violence shelters that are providing these 24/7 services. And so we're continuing to try to make sure that not only that those dollars remain and are stable, but that there's increased funding to support them. So that's a work in progress. I think what we know is that we have a legislative leadership and governor that are committed to our social safety net and to the issues of vulnerable communities, including survivors. And at this point, we're just kind of navigating the budget process day by day, as I think everybody is.
Marcella, Sheila, anything to add?
Yeah, I was just going to add, at Human Options, we've been very fortunate to have private donors who have given and foundations that have given, and really appreciate that they've been stepping up and unrestricting their gifts and trying to really help us mitigate this changing environment. And so that is amazing, and it's great. I think one of the things that looking at the longer term, right, looking at when you accelerate giving in one period of time, that means the giving in the future is going to go down at a time when it's actually most needed. And so that's something that is obviously a worry and something that needs to be addressed, because what Krista so eloquently said is the need is really going to rise, right? As people begin to come back to work and find the opportunities to reach out. And what we'll find is that they'll actually be in more traumatic states at that point. So they'll have much more prolonged exposure to the trauma and not quite be able to deal with it. In addition to that, we are also having an increase in expenses. So cleaning supplies, being able to stagger schedules, making sure that we have the resources to navigate the changing needs. And one of the things that private donations and foundations have done so well is to give us unrestricted support that we can move around and really be nimble and adapt to the changing need, whether it be assistance with rent, whether it be assistance with food, whatever that need is. And so, all of these things are happening as we're looking at the potential for funding to be a little bit more stretched than it has in the current environment. It will also have increased needs, because now we'll have to do these things in a virtual format to some extent for an extended period of time, while also maintaining an environment that is safe for individuals to not just come into when they're fleeing an abusive relationship, but also to working.
Very good points. Thank you. Sheila, anything else to add?
Yes, a few things. I always find that people are very surprised when they find out that of all the funding that is out there for child abuse, only 5% of it is allocated for prevention, and the rest only kicks in when a report has been made and substantiated and we know and can document that the abuse has occurred. So it is always difficult to get those funds out and to be able to provide services to families early on. We too are very, very concerned about what's going to happen in the near and distant future, because we know that some of the counties are having very reduced numbers of hotline calls to their county hotlines. And they know, I would be the person most delighted in the world if I believed that was because child abuse was going down. We know all the risk factors. We know isolation is a major risk factor for the safety of children. And so we believe that as soon as people are back to some level of normalcy, that those reports are going to go way up. And importantly, they're going to keep going up because many of the children will still not have anyone with eyes on them until they return to school in the fall. So we think there are going to be two big peaks coming up in the future with children. We're also really concerned, and this is another very important issue. Foster parents right now are under a great deal of stress. They may have a full house of foster children who already, by definition of having been removed from their families, have been traumatized and need supports. They need more mental health supports. They need more counseling supports, and so on. But those families don't have to continue to be foster parents. And if it's very difficult for them and if it's very stressful, we're very worried that there aren't going to be those foster parents out there to be able to even house those children who do get reported. And so it is a really serious concern. I will give a shout out to the governor that he has allocated $3 million for this next 2 months to help family resource centers reach out and work more closely with families. And certainly they, like everybody else, are working under hard circumstances, and the demand just for the basics that are needed are huge. What we're also seeing is some of them don't really have the technology they need to do the kind of virtual services that need to happen. And you're all correct that donations now are not coming in, fundraisers are not happening, but people are trying their best to continue to do the services. But we think the costs and the need are going to go up exponentially in the next few months.
Thank you. And all three of you talked about this coming surge when we get back to some sort of a new normal. And Greg, you talked about this in your opening comments too, that it's not just after we get back to this new normal that we're going to have a long-term impact for mental health issues arising from this time frame that are going to impact the mission of each one of your organizations. And so with that, let me ask you and Kristen, do we have the shelter capacity personnel to meet that increasing need, both in the short term and the long term?
Well, I'll go first on that. So each shelter operates a little bit differently, I believe. I know we all different number of beds and different setups. Some of the shifts that we've had to make, for an example, like our safety net program is where we will take somebody out of a dangerous situation and put them into a third-party location for a period of time, usually a day or two, until we bring them into shelter. Well, now for the safety of COVID and the safety to protect them from COVID for the clients and also the staff, is we've now put them into the safety net for 14 days. So that's a huge increase in expense alone before we bring them into shelter. Now, our shelter, we have approximately 42 beds in our shelter and 10 cribs. I know WTLC, I think they have, they're set up a little differently. I think they have independent apartments. So it operates a little bit differently. I think the number of people coming in, we're gonna have a full shelter. We're gonna have a full transitional living program. We do have also an outpatient program and Laura's House is expanding. Actually, we're making a move at the end of May we're going to double our size to provide outpatient services. So that will be some benefit, but for the shelter services, we do have a limitation on our ability to take a certain number of people at a time. One of the issues also with shelter services is that if a client comes in, they're restricted, they can stay for up to 45 days. And so if there's some type of, and sometimes it may be more difficult to find longer term housing for someone, especially during COVID. So having some type of extension program through the county or through CalWorks, that would be a great benefit as well.
Thanks. And Kristen.
Yeah, so Congressman, Child Help in California has what we call a village. It's a residential treatment center. We have about 86 kids, and these are the most abused kids out there. They're one step away from needing psychiatric care because of the type of neglect and abuse they've been under. Kids come to us, we've got, like I said, 86, but the trouble is for us right now is transitioning them in and transitioning them out. It's going to take a lot longer to do so, to get them placed. We're having to separate kids into smaller areas. We've had to set up a quarantine area in case somebody gets sick, and knock on wood, thanks to our really hard California staff, none of our staff of 200 or none of our kids have gotten sick yet. But we've had to take those precautions, which really has slowed down the process. Another challenge we're looking at specifically at the residential village is we have schooling for the outside community for kids with special needs. Well, we're not able to bring them in and give them the resources and care that they need because of the transmission process. So you have these kids with even more special needs who are used to getting care from many specialists today, now at home not getting that care, and specialists who are not able to work. And then one last thing that we're experiencing with this is within our foster care system, as somebody else mentioned, we are not doing visitation for our foster care kids because the risk is too high. And so that's extra strain and services based on our organization and the families, as well as not able to put families who do want to foster through the system fast enough, and causing significant delays to get willing and ready families to take in kids who are desperately needed. And we're seeing in all these cases, from group homes to foster care to residential treatment, a lot of new abusers. Like you all have said, abuse is not new and this has been underfunded. But now we're seeing parents who typically before could pull it together and get help and have family to step in when they need it, now don't have that and are lashing out in ways they've never have before. And so it's creating a whole new dynamic for our organization, and I'm sure child welfare wide.
Krista, thanks for sharing that. And I think we all know that anybody who is homeschooling their kids has to be meeting challenges they had not anticipated. And as you rightfully pointed out, that's even much harder when you have a special needs child in this environment. All right, so we're moving to the lightning round. I'm going to ask each of you two quick questions. Please give me your quick answers, and then we'll be finished here. And so, Mark, I'm going to start with you because it's been a while since I've asked you a question. So the first question is, did you take advantage of the Paycheck Protection Program?
We did not. We were very fortunate to have some cash reserves on hand from successful financial situations of the past couple of years. We felt like there were other businesses and nonprofits that really do desperately need access to those funds to just keep their doors open. So we decided not to apply.
And second question for you. If you could tell a member of Congress one thing you'd like to see in the next round of legislation, what would it be?
I would like to see more intentional effort to help those without documents, because most of the calls that are coming through our hotline are those that are Spanish speaking only and prefer not to disclose their citizenship status. And we presume that's because they are those without documents, and they are probably the most vulnerable out of already the vulnerable population group of the survivors that we serve. Even if there is some level of relief, this narrative about public charge and other things and deportation is just really preventing these individuals and families in accessing services, and the responsibility to be there for them should be shared not only with the nonprofit organizations like many of us here, but with private sector and also the government agencies as well.
Gotcha. Sheila, how about you? Was your organization eligible for the PPP program? And if so, did you guys apply?
We did apply and we've already received the funding. So we're very
That's
grateful
great.
for that.
I'm glad to hear that. And if you could add one thing for consideration in the next round of legislation at the federal level, what would it be?
We need more funding for prevention so that as we go back to being in our normal state, I'm already hearing from child welfare directors, they can't possibly handle the load that's going to come. They're really going to have to depend on the community-based sector. So we are really hoping that there can be some additional funding for prevention services.
Thank you. Krista, how about you? Was your organization eligible and did you guys apply?
We did not apply for the PPP.
Okay, and if you could add some issue to be addressed in the next round of legislation, what would that be?
Increased funding through the Violence Against Women Act and the Victims of Crime Act, with a waiver on any matching funds requirements that come with that. And I'll echo what Mark said about ensuring that the relief that's provided to individuals is available to all individuals, regardless of their status.
Good points. Marcella, you're next. And how about the PPP program? Was that something your organization was eligible for and or applied to?
Yeah, so we were eligible for it. We did apply because our major gala was scheduled for mid-May, and that's $500,000 of our revenue. So we are in process of an application but have not received confirmation yet. And then your second question, in terms of what I would say, just to not repeat what's already been said, is really designating money for housing for victims of domestic violence. We've seen when there is a designation and there is unrestricted support that they can be successful. During this COVID pandemic, we weren't expecting our residential clients to move out to permanent housing, and yet we've had 3 successful move-outs as a result of funding that came from VOCA funds that were released from Congress to provide housing support. And so, you know, it's possible if you invest in the services that are needed for victims of domestic violence.
Yeah, good point. I mean, housing affordability, access is an issue for a multitude of constituencies and clearly the groups you serve as well. Kristen, you're next up. Was the PPP an option for you guys?
Perfect. Thank you for the opportunity. We did not qualify, unfortunately, for PPP because we were just over the amount of employees that was required. And so that's a challenge for us and similar organizations. We're small, we're self-funded, but we're just a little too big. But the majority of our employees work at, hourly wages. So just put that out there for you to understand the kind of some of those challenges. For our specific ask, and I'm grateful again for the opportunity to speak with you personally about this, would be for funding for the National Child Abuse Hotline. DV, like you had mentioned, got $2 million in this last package. We'd be grateful for anywhere from $500,000 to $2 million, being respectful of the fact that we would want to spend money quickly based on the needs that are there right now. We are a part of a consortium of the 6 top hotlines, including DV, who monthly refer about 350 calls our way because it's outside of their expertise. So we, like I said, we were working on getting a line item. It passed through the House, but was moving in the Senate before COVID happened. So that would be our ask, and a huge grateful help for the work we're doing with our kids in California and across the country.
Thank you. Appreciate that input. And Greg, as Lawrence O'Donnell says, you get the last word. So did your organization, was it eligible for the PPP and did it take advantage of it?
Yes, we were eligible. We applied. I believe we'll be receiving it shortly.
Excellent. That's great news. And if you could talk a little bit about, briefly, if there's one thing you'd like to see added to any future federal legislation, what would that be?
Well, I liked everyone's answers. They were all fantastic. Mark, I love, we like Mark said, we do get a lot of calls for help for undocumented individuals, and it's becoming more difficult to serve that population. But just that they would be open to looking, because of the wave that's going to be coming, of the amount of services that are going to be needed, to be able to raise the funding for all the services that we provide accordance to the wave we're going to see.
Thank you. And for all of you who have watched this program at this time or at a later time, you can see what great hands you are in with the talented individuals we have in Orange County, helping us and our neighbors through these difficult times, especially when it comes to domestic violence. You also have a clear understanding of the challenges they face in doing their mission and helping those that so desperately need our collective help. And I hope you also recognize that you play a role here too, whether it's being able to donate to these organizations, support their endeavors, or just keeping an eye out for vulnerable individuals and family members around you and in your neighborhood and in your community. Please make sure that you have an opportunity to help as well. And again, to all of our panelists, thank you so much for everything you do. Take care.
Thank you.
Yeah.
Thank you.